Let me ask you a question differently. Would you prescribe someone that wanted to lose 10 pounds this drug?
Fight, diet, and exercise, that if you stop these medications like Ozempic, you may regain the weight.
People stealing this drug from diabetics. What is your position on that?
How do we get them off of these medications in a methodical way?
Their dad actually had really significant or severe heart disease, and they were on this medication, and it really benefited. Like, how does that work? How does it help your heart?
But let me tell you what happened to me when I was taking a shit. Exhibit fucking A. I am bald-headed.
Talk about that.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.
Hello, everybody! Welcome to another episode of Suits and Scrubs. We talk about a little bit of health,
A little bit of wealth
and a lot of love. Guys, we have a special one for you today. Before we get started, I will introduce my beautiful co-host. This is Emily MD. She is a gut, hormone, and weight loss doctor. She can heal you from the inside out. Fun fact about Emily, if you guys are not watching us on YouTube, we actually got this in this dress on our anniversary. Mm-hmm. So it looks like a kimono, honestly. It's kind of cool. So
We got it in Hawaii.
yeah, it looks like we're about to fly off and go to the islands after this. Wouldn't that be nice?
That would be nice.
All right, take it away.
So, welcome everyone to another episode. I'm joined by my co-host, Mr. Zachary, SVP. He is your Coast-Fire guru. He will help you retire before age 40.
Yes, I will.
And I don't have a fun fact prepared, but I've noticed that we're matching today.
We are matching.
Great minds. I feel like we always somehow match in some way.
Yeah.
It always works.
I got dressed first. All right. So guys, on today's episode, we have about 7 videos lined up. Some are trending, some are not. The title of this episode is Doctor Reacts to Ozempic TikTok Advice, TikTok videos. So I know you guys are seeing this blow up everywhere. We are too. It's everywhere. And every time you scroll, you see something on Ozempic. So we're going to watch a video, and then Emily's going to react to it. That's all today's episode is about. It's us reacting to all the things Ozempic.
And I have not seen any of these videos, so
She has not. So twist that we have for you guys is she has not seen anything. So we're really going to put her to the test. I think she'll be okay, though. This is her bread and butter. She talks about this all day, every day. All right. So, guys, the first episode, I'm going to play it. And I'm going to describe it just in case it needs a description. Because some of them do need a description so you can visually see what the person looks like if that's required.
am I going to be
I'm going to
Just
describe it to you.
listening?
Just listening. That's
Okay.
right. So he hasn't seen these guys. Okay, video 1.
When I see people who are showing up to our practice who say, I got a wedding in 6 weeks, I got to lose 10 pounds, put me on this drug.
What are the long-term worries that you have? And this could just be a generalization. Like if somebody is maybe not a pure health candidate that's doing it because they want to tighten up that 10 pounds or 20, like what do you see as the long-term risk?
That's part of the problem, Michael. I don't think we know. And that's the problem I have with really being able to tell my patients, like, this is a lifelong strategy. And that's what I say to patients as well. I'm like, look, I think there's probably a net benefit to you doing this in the short term, so let's give it a shot.
Short term meaning?
Let's do this for a year. I think what I'm...
They keep going on, but I think there's a lot to unpack there. So we can, I think there's 3 big things I hear. But go ahead.
It sounds like they're talking about the short term versus the long term, and a lot of people coming in wanting a quick fix because they have XYZ coming up, a wedding or a college reunion or high school reunion or whatever.
So let's address the vanity portion of this, and then let's talk about short term and long term.
So I'm sure a lot of what he's talking about are people concerned about how others are going to perceive them, and maybe people who haven't seen them in a while, maybe people who haven't seen them since before the COVID pandemic, and they're embarrassed to be seen weighing more than they did before. And so there's that vanity component that...
Right. But how do you feel about the vanity component about people taking this drug You know, because I know how strongly you feel about it because I hear your stories every day. So how do you feel taking this for vanity purposes?
Well, I think it's not for that sole reason, and you have to do it in a healthy way. But a lot of us, we feel better when we look better. I'm not saying that should be the sole purpose of losing weight, but there is something to be said about confidence and getting your confidence back.
So let me ask you a question differently. Would you prescribe someone that wanted to lose 10 pounds this drug?
I don't think it's appropriate to take the medication just to lose 10 pounds for an event.
I don't think so either. I actually think that's kind of bullshit because, there's people out there that really need this drug, right? And so we talk about the shortages of Ozempic and GLP-1s.
agonists.
I will get it right, guys. I promise. And I think the deficit from diabetes patients, and I think that we actually have a friend of ours is a diabetes patient, right? And people are trying to buy Ozempic off of him. It's insane, right? And so there's a whole vanity aspect of it. I'm against that. I don't think that's the right answer.
Yeah, I mean, I think the way how you frame the question, I don't think people should feel bad for wanting to look good necessarily, but I don't think that should be the reason behind taking a medication to lose weight.
I'm not saying that at all. I think if people want to look good, go do it. But my thing is get up in the morning, exercise, eat healthy, stop drinking, stop eating processed foods.
Well, it's a process, and we're kind of talking. I feel like we're talking about different things, but
we're not. This is all Ozempic. To me, this is all related. This is the number one issue that people have with Ozempic is for vanity purposes.
Well, it shouldn't be a quick fix. There's a difference between taking it because you're a candidate for it and you've tried everything and you still can't figure out how to make things work. I mean, we've talked on prior episodes about addiction and
right.
and it's not just a matter of willpower. Sometimes you need a little bit of help to get to where you need to go. I don't think that it should be the magic bullet. It shouldn't be someone is trying to drop 10 pounds in 2 weeks to go to a high school reunion, and so let's put them on this medication
right.
to help them drop it. And that's not how the medication works anyway.
Right.
It's not going to, if you're dropping that much weight, it's typically water weight, or it's not a sustainable. And I always tell my patients at most 3 pounds a week, and that's aggressive.
Right.
1 to 2 pounds a week
did hear you say that.
of weight loss
right.
is perfectly doable. And I think the 2 to 3 pounds a week is even a bit aggressive for people. This should be, like he mentioned, this should be at least a year of work, and it shouldn't just be the medication. It should be the medication and diet and exercise.
Right.
So
your stance is no on vanity. You don't lose it for 10 pounds, but your stance is yes if it's something that you need and it's a long-term commitment with other things included.
Yes, it shouldn't be a Band-Aid, and it shouldn't be a magic bullet. It should be a part of a lifestyle change.
Gotcha. Now
It should be a tool.
A tool. So another thing he said was that we don't know the long-term benefits or the impacts. I would say not benefits. What do you say to that? I mean, these drugs are not new. They're not new, guys. They're not new. So tell me what you think about that. We don't know the long-term benefits or impacts.
I mean, so the specific medications like the Ozempic, Wegovy, the Mounjaro, Zepbound, those have been a little bit newer, but the mechanism behind it, the class of medications have been here for a while.
Right.
The Victoza and Byetta and Saxenda, those have been here for years, and we see the positive effects. And I think, if anything, the more and more studies and results that are coming out now are showing the positive impacts, the benefit on cardiovascular disease
That's
and cardiovascular
big.
risk factors.
Yeah.
Having a new indication outside of just diabetes and even obesity, having a history of coronary artery disease
right.
would be another reason why you could have an indication to start this medication. We're seeing improvements in obstructive sleep apnea, fatty liver disease. All of these obesity-related conditions are improving, and we're seeing better outcomes with these medications.
Right. And that's one thing that one of my friends were saying in my group, that their dad actually had really significant or severe heart disease. and they were on this medication, and it really benefited. Like, how does that work? How does it help your heart?
I think we're learning a lot of new things about the medication. Some of it is certainly improving the metabolic risk factors. So you're helping people lose weight, and they no longer have this obstructive sleep apnea, which is a stress on the heart if you have OSA. And so you no longer have hypertension. You no longer have the elevated blood sugars, the diabetes, and it's helping with your cholesterol profile. So you have all of these things that can contribute to worsening heart disease that are improving steadily. And then I think there's also this component of improving your insulin resistance and inflammation. You know, hearing patients that have lupus and rheumatoid arthritis who have autoimmune conditions where they're taking these medications and their autoimmune conditions are improving.
Wow. So, okay, let's take a stand on this. So we do not know the long-term impacts of this?
I think we're seeing, you can't definitively say that I know everything that's going to happen in the future on this medication, but I think from what we're seeing, it only has positive benefits. But you can't say that beyond a shadow of a doubt.
Right.
But I think the research is showing
I'm gonna make her take a stance, guys.
No, but you shouldn't.
But I understand what she's saying. She's a doctor and she has an answer. It's like not one size fits all. I get that.
Mm-hmm.
But ultimately, he's saying we don't know the long-term impacts of this medication. You're saying that.
I'm saying
you agree with him.
Yes, we don't necessarily know. I mean, they're just kind of like medications that came out. We did the endocrine disruptor episode where the DES.
That's true.
Was out and people were using it for years and years. But I think we're much safer with our pharmaceuticals now. I hope we are.
Yeah.
But I think that the mechanism of the medication, what we're seeing, I don't think that we would see the improvement in all of these endpoints, especially these cardiovascular endpoints, if it was causing harm and damage to the body.
Gotcha. Okay. All right. So you actually agree with him that we don't know the long-term impacts. I thought these medications have been around forever. All right. So you ready for our next video?
I'm ready.
All right. I did a hot one out the gate.
When you get off of it, I gained double the weight back after.
I've said it before and I'll say it again. There's a real chance, despite diet and exercise, that if you stop these medications like Ozempic, you may regain the weight. Remy Bader claims that once she stopped Ozempic that she regained double the weight. However, there's no evidence that the medication actually causes you to regain double your weight or any amount of weight. The way the medications work is they suppress your appetite. So once you stop the medications, any pre-existing habits you had before or obsessive compulsive habits you may have had, that's going to kick back in once you stop these medications because you're no longer suppressing your appetite with them. So here's a mind-blowing idea. Maybe you don't need to stop the medication because you don't. You can take them indefinitely. I know people don't necessarily want to be dependent on medication. However, if they're suppressing your appetite, you're losing weight, you're healthier, you're fitting in your clothes better, you're feeling better about yourself, that's not such a terrible thing. So
That also is a lot to unpack. So
Yeah.
what do you think?
I would agree. I think
Two things there, I think.
Yeah. So there's this, and on a prior episode, we had the Jillian Michaels where she goes off on her little tangent about how you gain the weight back. You're going to gain the weight back eventually. You're going to hit the plateau. And I think we see that with just weight loss in general. And we've talked about it in prior episodes that when you lose 10% of your body mass, of your body weight, your hormones automatically start to kind of turn on you. So they make you increase your appetite and slow down your metabolism to try to get back to that set point that you were at before. And so it's not just the medication, it's not just being on Wegovy or Zepbound that is the reason why once you stop, it's not that there's something about the medication that makes you gain all the weight back. It's that's just normal physiology. If you're going to do it, if you look at all the studies that show people who do weight loss just with lifestyle, if they're doing a calorie deficit or they're doing a combination of calorie deficit with or decreased caloric intake and exercise, you're still going to see that upward trend. And so I think that's kind of like the first half of things. The second half would be talking about whether or not
saying that she doubled the weight back. She's pretty much saying that the drug made me want to
the drug
stop
made
using
me do it.
Yes. So when I stopped using the drug made me do it. I don't want to glaze by that. That's pretty much what she's saying.
Yeah.
And you're disagreeing with that.
Yes, I'm saying that the medication was helping lose the weight, but when you stop the medication and you are no longer getting those benefits from the medication, especially if you haven't changed your lifestyle, there is definitely a strong potential that you're going to gain all the weight back plus some if you're continuing to live those habits.
Gotcha. Okay. So
Not saying, and I don't know her story. I don't know if she was eating a certain diet or exercising. So, but I would say that that's the typical story, is that often people will use it as a crutch sometimes, and they'll find, great, I don't have an appetite anymore. I just won't eat anything, or I'll be able to completely decrease my caloric intake every day, and they start to lose the weight, but they don't really focus on the quality of the food that they're eating.
Gotcha. Yeah, so they're eating less of the bad stuff, and they're losing weight because of it.
Yeah, they're not having the cravings or the mindless snacking.
Yeah.
But they might not be choosing healthy options or increasing their activity level.
Okay, well, part 2 of this. So your stand is getting off these the medications are not going to make you gain the weight double back. It really is just a lifestyle choice. It's suppressing, your appetite.
And it's not just, I think these medications are more complex. It's not just suppressing your appetite. So it's slowing your stomach emptying so you stay fuller for longer. You're able to have better portion control. It also does act centrally on the brain to quiet the food noise and the food cravings, but also helps with the balance of blood sugar and insulin. And so in some way helping with that insulin resistance. And so it's helping kind of more hormonally and metabolically to help people lose weight. So it's not just the appetite suppression.
Jeez, it makes me want to sign up for it, honestly. All right, so the part 2 thing is, so you agree it's not the medicine, so it says, I mean, we actually, no, we disagree. Sorry. And then the second part of that is the doctor that was pretty much reacting to what she was saying. He was saying that he just be on medication for the rest of your life. What's your position on that?
I think you can go in one of 2 directions when you take these medications. I think one option is to stay on them forever, because they have been studied to be safe for chronic use. We use them for diabetic patients for blood glucose control. And so it's definitely an option. I think the climate that we live in right now, where they're impossible to find and they're so expensive, would make you say this is probably not a viable option, at least for right now, for most Americans.
Right.
And so I think the other side of the coin is to say, like, how do we get them off of these medications in a methodical way? And I typically like to kind of steadily wean and keep a pulse on things to make sure, not just stopping the medication cold turkey, as you're weaning, are we having a rebound in cravings? Are we starting to kind of go back to certain lifestyle habits that we shouldn't be? And a lot of the studies show on the back end, exercise is even more important. On the front end, it's important to eat the healthy diet. You can't outrun a bad diet. You always hear that saying. And so I think that is so important for the weight loss aspect. But once you get to the maintenance phase, a lot of the studies show that the people who are actually able to keep it off are the ones that are active, that are busybodies, that are getting their 10,000 steps in a day, that are exercising in some aspect, in some capacity, 60 minutes a day, doing some form of resistance training. Those are the ones that are able to come off of the medication successfully and maintain the weight loss.
Gotcha. And you're such a naturalist, so I would imagine that you would prefer that option, right? The second option. And so would you agree with the doctor then? Is that ding or be on it forever? Like are you not saying that, are you okay with that? But if that's an option that can only work for someone, but let's say that people have a food addiction, or listen, I have an addiction, I get it. So what would you say to that?
I would much prefer a person be on this one medication for the rest of their life if it meant that they were not going to also have end-stage diabetes or heart disease because of their obesity. And then they would be on all of these other long list of medications that cause potentially other side effects.
That's a very fair point.
And so So I think if that's the only way that you're able to keep the weight off, then okay. I think it's a safer option than being on.
So you agree. So that's a ding. Wow. Okay. I didn't know that. So, all right. You ready for the next one? Mm-hmm. All right. So this she is dancing. I'm going to say me trying to distract my dad while I steal his Ozempic because summer is coming up. He has diabetes. And she's dancing in the background.
You guys out because Ozempic is not that hard to find. I'm gonna tell you where to get it. If you don't know, Ozempic and Mounjaro are specifically made for diabetic patients to help with insulin resistance. And if you don't have diabetes, it's damn near impossible to get insurance to cover it. So you'll be paying about $1,000 out of pocket. This is what you're gonna do. You're gonna go on Google and you're gonna look up medical weight loss clinics near you. I'm a medical assistant at a medical weight loss clinic in North Carolina, and we offer the active ingredient that's in Mounjaro and Ozempic. It's called semaglutide. It works the exact same. It's used for weight management, so you don't need a prescription for it from the doctor. You just go to the clinic and whoever the provider is can get it for you as long as your BMI is over 27. We start everybody off at the lowest dose, which is 10 units or 0.25 milligrams, and then you go up every single month, just like Ozempic, and you can lose up to 5. I've seen people lose up to 10 pounds a month on.
All right, she keeps going on. So let's focus on the first thing. People stealing this drug from diabetics. What is your position on that? Or asking to buy it. And by the way, like we said earlier, we had someone in our group in our friend group that said that really happened, or that keeps happening.
I mean, the whole using someone else's prescription is just not okay in general. You know, there's a reason that they have that prescription and that medication, and they should have it. And you need to go through the appropriate avenues if you're a candidate for it to get it yourself. And I know there's the other side of things where people are saying that technically people are stealing from diabetics, even if they do get a prescription, because they don't have diabetes. They have other indications for being on the medication. But right now, I mean, just with insurance coverage, you can't get these medications if you're not a diabetic. And we talked about the semantics of the brand names. So if it's Mounjaro or it's Ozempic right now, those are FDA approved for diabetes. And the only way insurance is going to cover them typically is if you actually have an A1C of 6.5 or greater, if you actually have a formal diagnosis of diabetes. And usually you have to document that and show that you've had blood work done. So it's not something that you can just skirt around. But the Wegovy and Zepbound is specifically meant for weight management. It's specifically the brand name, that's exactly what it's for. And so people who are going to get this medication typically don't have diabetes, because if they did have diabetes, then they would be going the other route and going with one of the other brand names. And so I don't think that they're stealing the medication. I think right now there's just a shortage. If you're able to prevent diabetes, I think that's also a beautiful thing. We don't want all of these people who have obesity to end up in that same group of people. Like, we don't want to push them all into diabetes.
Right.
If we can treat it on the front end and we can help them to lose weight and to change lifestyle so that they prevent that from happening in the first place, I think that's another way of looking at things.
Yeah. So the first one is, should you steal Ozempic from diabetic patients? Emily says no.
Please don't do that.
Please don't do that.
That's illegal.
All right. And the second thing is it damn near impossible to get this medication unless you have diabetes?
I mean, it's pretty close. We're having serious shortage issues at pharmacies.
So we agree with this. Ding!
That it's hard to find.
Hard to find.
It's not impossible.
Not impossible, but it's hard to find. Okay. And the third thing is, she said going to a weight loss clinic, to get this, as long as your BMI is over 27, blah, blah, blah. Mm-hmm. Do you agree with all that?
No, I mean, you have to, I don't understand what she's saying. You don't have to have a prescription for it, because typically, especially if you're getting the right kind of semaglutide or tirzepatide, a doctor still has to prescribe it for you.
Right.
And she's alluding to, I think, getting the compounded version, which we did a whole episode on compounding pharmacies and how not all of them are created equal.
Right. And be safe with it, guys, because you want to make sure you understand what is injected to your body. Yeah. We actually rushed that episode because we want to get it out there to help people.
But you talk about, the other issue that we're having in the world is kind of the opiate crisis and people turning to heroin or street drugs, street opiates, because they can't find it. We're being so selective with who we're giving pain medications that it's causing even worse issues, because people are going out on the streets to find more dangerous forms of medication for pain control, and that's a whole nother.
I'm about to say, let's solve Ozempic today. We'll talk about that.
but I feel like it's
that's your point.
It's got similar connotations in that people are desperate for this medication because it is very effective, and we're seeing, and it's people who maybe even qualified that could get because there were some insurances in the beginning that were allowing people who didn't have diabetes but did have obesity to get prescriptions for the Mounjaro and the Ozempic, and they were on this medication. They were able to lose 80, 100 pounds, and then all of a sudden insurance says, I'm not going to cover it anymore. And then they are absolutely desperate because this medication was life-saving for them and changed their entire life. And then they're so afraid that they're going to gain all the weight back. And so they will do anything to find it, whether they're looking on the black market, they're going,
It's dangerous, though.
Yeah, they're going to international online pharmacies.
Oh, wow.
I mean, there are all kinds of scams going on. People trying to steal your money. They won't actually send you the medication.
Right. And we did a whole episode on this on compound pharmacies. So we'll link that into the show notes just to make sure that you guys have access to that, because that's very, very important. And we dive deep into this. What are compound pharmacies? What should you look for? You should not buy it from your hairdresser. Yes, I'm talking to you.
Also some of the things that I'm seeing out there, following different dosing schedules, if you're not following the kind of the standard dosing, that's usually a red flag too. Having, it's supposed to be a once a week injection, and then having some of these people say, well, I went to this clinic where they were injecting me every single day and I was so nauseous and I felt horrible, but they told me that was the right amount and that was going to get me my weight loss and that was going to get me the numbers that I wanted. And so you really have to be careful. Is there medical oversight? Like who is injecting these medications and where are they getting them from?
Right.
It's scary.
Yeah, you just don't want to do it willy-nilly. So we agree that 2.5 is the starting out dosage.
0.25.
0.25. All right, so don't steal prescriptions. We do agree that
That there's a shortage out there.
There's a shortage out there. We do agree that you can get it through other means, but don't.
It's very controversial.
It is very controversial, but don't get them from your hairdresser on the black markets. Which honestly sounds like common sense, but you do have options, right?
But it's really not common sense anymore because you can get it on every street corner. So you really, I think it's hard for people. It's hard for the consumer, the average American to know what's safe and what's not safe anymore.
Yeah, that's fair. That's fair. And we did a whole episode on that. All right, so let's do this one.
Real Dr. Babe,
This is a good one.
is it true you shouldn't drink on Ozempic? I'm Real Dr. Babe, board certified plastic surgeon, and this is the truth. A lot of patients asking me before St. Patrick's Day if they could drink on Ozempic or any of the GLP-1 receptor agonists. And the truth is, you can. But you just may not want to, because the way these medications suppress your appetite for food, they may also suppress your appetite for drinking or vaping, smoking, or even opioids. There's actually a study out there, a small case study, that shows that people actually reduced their risk of alcohol use disorder by being on these medications. So you don't get sick necessarily by being on these medications and drinking. It's just that you may not want to drink.
Yeah, no, I 100% agree with that. I don't necessarily agree with the point that you can't get sick, which I don't think he was even focusing on, but it can just like you can sometimes have certain food aversions. Some people have aversion to drinking and don't have the desire to drink, which is a good thing. And you mentioned like the vaping and smoking. So it can have that positive, because it does act kind of centrally on in your brain, the hypothalamus, on cravings. But if you think about it, the medication is slowing your stomach emptying, so it's potentially going to keep the alcohol on your stomach for longer. And so I think there is that potential for it to, when you do drink, for you to feel more nauseous or sick to your stomach. And I would think it probably could also increase the risk of having stomach inflammation and gastritis. But I would say yes. I would agree with.
Gotcha.
with that
So
clip.
Emily says, don't drink on Ozempic. She agrees.
At least not. I mean, I think if you're drinking in moderation, if you're having a glass of wine.
Well, they said
St. Patrick's Day. You should,
We some St. Patrick's Day people.
yes.
So.
don't do Ozempic, or we go via Zepbound or any of the GLP-1s and then go on a bender.
Yeah. All right. Are we ready for our next one?
Should not be allowed for weight loss. Mark my words. Put them in a time capsule and open it in 15 years. Ozempic has a remarkable weight loss, but what they didn't focus on is that when these people are losing weight, they are losing muscle mass at a way higher rate than they should. As you play this forward, especially in elder patients, when you lose that much muscle mass, you cannot gain it back without extreme measures. The chemistry behind how they're losing that weight is really a starvation weight loss. This is the kind of weight loss that will decrease their immune system, decrease their bone density, decrease their muscle mass, and decrease their longevity.
All right. I did pull this one out on purpose. So what do you think about, there's a lot there too. So what do you think about that?
I think it's the exact reason why there should be medical oversight when you're taking these medications, because, and with any form of weight loss, there is that potential that you can have some muscle wasting. So you are losing some of that healthy tissue along with the fat that's lost. Just like someone who decides that they're going to lose weight by exercising, by doing cardio every single day, and they just do cardio and they're not fueling those workouts, they're going to lose, they're going to lose weight and they're going to lose fat, but they're also going to lose some of that muscle tissue, which I know when I was, fourth year of med school and all I was doing was running, I ran my butt off. I had no butt left because any muscle that I did have back there was no longer there.
And guess what, guys? If that was still the case, we would not be married.
That is not my problem
Because
right now.
I like both. I'm a T&A kind of guy, if you know what I mean.
So it's possible, just with weight loss in general, to waste some muscle if you're not doing the appropriate things. And I think it's important that patients on the medication be counseled. You need to be eating a high protein diet. You need to be doing resistance training while you are on this medication, and you should not be dropping weight rapidly. I think you still need to be following the 2 to 3 pounds at most a week. And if you're dropping weight much quicker than that, sometimes it means that the medication is at too high of a dose and you're having such food aversions or such nausea that you're not getting the appropriate nutrients, the appropriate nutrition. And so I think there's always that balance. We need to help to cut off the food noise and the cravings and help with the blood sugar and insulin and all of the things that the medication can help with, but not suppressing your food drive so much that you're having nutritional deficiencies.
Gotcha. So do you agree with her that there's could be some severe muscle wasting if you're using this inappropriately?
If you're using it inappropriately, yes. But I don't like how she lumps everyone using this medication, or this is a horrible medication to use.
It's weight loss in general, though. That's the thing, though. That's so interesting to me about this. And, I'm married to medicine here, so I could speak to it, and then I'll look to you if I'm correct. But I think any sort of weight loss, we did a whole episode on Ozempic Face, our number one trending episode on YouTube, still trending. And we did a whole episode on that. And it wasn't really the drug. It wasn't the drug that did this. It's weight loss. If you do weight loss unhealthily, it can lead to that. And same thing with weight. That's why, for example, the first few months of the year, I was only interested in doing cardio. And I was doing like heavy, intense cardio. I dropped like 20 pounds in a month. I ran 40 miles in January. And I talk about that on the podcast. And so now I completely switched. I work out 6 days a week. I go for 45 minutes. I do 10 minutes of cardio and then do 45 minutes of weight training. I have a walking desk right here. This is my office, by the way. And I do about an hour of walking, because I don't like the way I look when I lose weight, because like a bunch of weight like that, and if I don't do like heavy lifting, like my body doesn't look like the shape that I am comfortable being in. So I think that there is some healthy ways to do it. So in my opinion, like if you are on Ozempic, you are doing weight loss, you should 100% be doing some resistance training.
Yeah.
I think that's just a requirement.
I think in any program, any weight loss program,
That's
that should
fair.
be huge, because the other side of it is that if you're building muscle mass, then you're helping to increase your basal metabolic rate. So if you have more muscle tissue, you are going to be burning more calories at rest than if you don't have that same muscle mass.
Right.
So I think it's important. It's an important part of weight loss in general, and that's the whole reason why I think the maintenance phase, it's so important to stay active, but also to have that weight training component, that resistance training component.
100%. 100%. All right. So we ready for our next one? All right. So this was a long one. We're only going to play the first minute or so. But
Where I left work yesterday was an appeal for Ozempic, and I won. I had spent at least 20 minutes on the phone talking to this lady with the insurance, and she was so nice and so helpful, and ultimately the outcome was good, and it felt so good to be able to do that for the patient and tell her that you are approved for the next year. And so much of the time we don't win appeals, so this is not always the outcome. It's not always possible, just depending on the insurance. But I wanted to tell you something about this particular case because it might help some of you. In this person's case, I had originally sent the Ozempic attached to a pre-diabetes diagnosis, and we did the prior auth, and it was denied. And when it was denied, I looked up the clinical criteria for her particular insurance, and it said that they do sometimes approve Ozempic for prediabetes if there are other conditions present. So this is when I called her insurance company, and I did the appeal over the phone. And for the appeal, I used 2 other diagnoses that she had, PCOS and metabolic syndrome, and this time it was approved.
and it goes on and on and on. But you know, I think. Well, first, let's talk about the approval process. We did this whole thing on the first episode of our podcast. Check that out, guys, because it talks about where have all the good doctors gone. So talk about that first, and then let's dive deeper into like this.
So I know in a primary care practice how difficult it was. Every single person that wanted to try this medication, I think it's very rare for insurance providers now to allow coverage of the medication without a prior authorization. And so basically a prior authorization is something that the doctor or doctor's office has to complete, and they put all of the patient's information to confirm that they have a BMI over a certain level or they have these other medical conditions. And a lot of times they'll also have to jump through other hoops to say, like, this patient has tried this medication and this medication first. So some insurance companies will say they have to try phentermine, or they have to try Contrave or Qsemi or Topamax. They have to try some of these other oral medications and fail them or have side effects before they'll be willing to try these injectable medications. And so every insurance company is different. But if you consider in a primary care office where you don't really have the resources to fill all those prior authorizations out.
Right. And the doctor's doing them.
Yeah, I mean, at our office, we were responsible for a lot of that, and then finally started a process where we had other staff that was helping us do those. But at the same time, the other staff is also doing a lot of other responsibilities. And so that list just backs up and backs up. Consider some of these insurance-based weight management clinics where they have a single provider might have 30 patients, 20 to 30 patients a day. And all of these patients, they're having to fill out that paperwork, the prior authorization.
Jeez.
You've got to have, and even if you have a whole team that's dedicated to doing these prior authorizations, most often they're going to get denied anyway. Insurance is going to find some way to deny the prior authorizations. And so they're not going to cover the cost of the medication. The patient's going to have to pay out of pocket. On a worst case scenario, it's $1,200, over $1,000 out of pocket per month for just a 30-day supply of the medication. And then you can use a manufacturer's coupon, which might lower it to $500, $550 a month.
Right.
And there are plenty of patients who are willing to pay that because they're so desperate to take the medicine.
Right. And even if you have the manufacturer's coupon, you can't find it, which not part of this refactions.
Yeah.
But
Or it's only for a certain period of time. So maybe you can use that coupon. I'm not sure if it's a full 6 months or 12 months. So when you get to that 12-month mark, you might feel great, like you're at your goal weight. But what happens after that? You just have to stop cold turkey. What do you do if you start to gain the weight back?
Right.
And that's why I think where a lot of people are scared is what do they do after they lose the weight?
Right.
How do they maintain it?
Maintain it. I think the maintenance is like, that's a huge opportunity for sure. That's something that I know that you're passionate about and helping other patients do this, right? And I think, so we talked about the approval process and so there's no really agreeing here. It's more about just hearing the story. I pulled this one on purpose because you can't visibly see her if you're listening to us on a podcast. She's kind of emotional, and what doctors have to do sometimes for their patients. And I think it's a really novel thing that she did. Whether you agree with Ozempic, whether you agree or not, but if you have PCOS and you have your
spending that time and doing the appeal
exactly.
process, I mean, that's a lot of
work.
A lot of work.
But the thing is, it doesn't matter if it's a lot of work or not. It's just when doctors are already working 80 hours a week, and I'm married to medicine, and I remember I'm sleeping. She she's always working, always working. They just don't have the time to do that. So I just thought it was really cool that she did that for her patients. So I just wanted to play that for her. So shout out to you, Wait Doc. I think it's her handle on TikTok. So shout out to you. All right, this is our last one. So it's only 15 seconds. I do need to. Actually, I'll let it play.
Tell you what. Well, let me tell you what happened to me when I was taking a shit. Exhibit fucking A. I am bald-headed. Like I said.
What on earth?
All right, that was a lot, but what she says is Ozempic made me lose all my hair. Talk about that.
So I mean, it's something that can happen, and I think it's you talk about things that can make people lose hair, like a stressful life event, whether it's emotionally stressful or physically stressful, having the flu or COVID or pregnancy can make you shed your hair. It can make you lose your hair, and sometimes excessively. And so I think if you're losing an excessive amount of weight, if you're losing the weight quickly, that in and of itself can certainly make you shed more hair. The other thing is if you're not, this goes back to making sure you're getting enough nutritional support. If you're so nauseous, you have such severe side effects that you're not eating the appropriate amount of protein, and you're deficient in things like B12 and vitamin D and iron, biotin, some of the building blocks that help you to grow hair, that's also a reason that you can not only have the hair loss, but have a hard time growing it back.
I did not know that. So you actually do agree that this could happen. So wow. All right. Well, guys, that has been another episode of Suits and Scrubs. So we talked about a lot. We reacted to what the internet is saying. And don't trust everything you hear, number one. And number two is if there's something that you want us to talk about, or there's a video that you want us to react to, let us know. Drop a comment, drop us a line, drop us on the website. Whoop, whoop. All right, guys, that's been another episode of Suits and Scrubs. A little health.
Little wealth.
And a lot of love. Until next time, guys. Bye.
He's on the hustle, she's on the grind. There's no time to kill. For saving lives and new deadlines, and there's some holes to fill. With a little health and a little wealth and a lot of love. That's a life that we live. Suits and Scrubs.